Multiple myeloma was a disease that has been known for centuries, but it was first described accurately in the 1840s by, it was a case history of a patient, Sarah Newberry, who had typical multiple myeloma with many fractures. In that same decade, another patient, Thomas Alexander McBean, was seen, and this person excreted a type of urine that is recognized today, that is Bence-Jones proteinuria. Mr. McBean also had symptomatic multiple myeloma, was treated initially with the removal of blood and with maintenance therapy, which consisted of the application of leeches. This proved to be of benefit to him, and for 6 months his bone pain was much, much better. He then relapsed and was given a concoction of steel and quinine, and this led to a resolution of his pain, and he felt very well for several months. He then relapsed and did not respond to any therapy whatsoever and died on New Year's Day, 1846. Then actually nothing therapeutically happened to multiple myeloma for approximately a century, believe it or not. And at that time, a new drug was introduced called urethane. About 10 years later, this drug was studied in a prospective fashion, comparing it with cola syrup, a placebo. And the survival was not different in the two groups of patients. Then in 1958, Professor Bloken introduced sarcolysin, as he called it. Today we recognize it as melphalan or Alkeran. This is still a very important part of the therapeutic armamentarium of multiple myeloma. Then in the early 1980s, Professor McIlwain in England introduced stem cell transplantation. The first patient treated was an individual who had plasma cell leukemia, and this patient responded temporarily, and in that same publication, Dr. McIlwain pointed out that he had treated 8 patients with multiple myeloma who also showed response. Then for several decades, we used a variety of alkylating agents and steroids, but they were proven to be no more effective than the original melphalan and prednisone. Then in the early part of this century, the drug Thalidomide was used for the treatment of multiple myeloma, and despite the fact that it produced many bad congenital effects following its introduction 50 years before, this immunomodulatory drug proved to be the first of the novel agents for the treatment of multiple myeloma. That is 150 years of the therapeutic history of multiple myeloma.